All right, so thank you so much, Joanne Johnson, for joining us. We are excited to put you on center stage. And so, with that, feel free to share with us, who are you?
I am Joanne. I'm a certified community health worker, and I'm someone who always been passionate about showing up for people, especially in hard times. My journey started years ago when I volunteered as an EMT and a rape crisis counselor. And over the years, that calling has just grown. I've earned degrees in human services, health services, and my master's in business administration. But it's the hands on work that I truly, really feel passionate about. From disaster response teams to community outreach in my church, I've been blessed to serve in many different areas. And I'm also a two-time best-selling co-author of books writing about resilience and healing because I believe our stories do matter. And being a CHW lets me combine all those parts of me, my journey, my service, my advocacy, and helping people to be seen. It's not just what I do, but it's who I am.
Okay, spot on. I love it. Thank you so much. We would love to learn a little bit more about what do you do?
Okay, as I said, I'm a certified community health worker, and I work with families with children up to the age of 18 that have uncontrolled asthma or other chronic respiratory illnesses. So, from helping them understand what asthma is, um, trigger responses, what may make one person have an asthma attack, whereas it might not affect the next person. Um, and then I also navigate care with them. But my role goes beyond education. I also build trust with them. I offer coaching and serve as a steady support system for them. So it's about meeting families where they are and helping them take the next step forward.
Perfect. Thank you so much. And I'm so grateful that you're in a position to be able to meet someone where they are. With that, I'd love to learn more about why does what you do matter?
Because no child should struggle to breathe, and no family should face that alone. And asthma is more than just a medical issue. It's about housing, it's about stress, it's about access to care. And so I can help fill in the gaps, guiding families through these challenges, celebrating sometimes just a small win, and help them create safer, healthier spaces where the kids can thrive.
Thank you so much. Tell us a little bit about your CHW story or your journey to where you are today.
Okay, so I began as a AmeriCorps volunteer with the RVA Health Corps out of the Richmond Community Hospital. And I supported adults in the hypertension program. I offered them coaching and helped them make lifestyle changes, improve their blood pressure readings, and also help them access care and find resources that they needed. Because if you have a medical condition and you get ready to get evicted, you're really not going to concentrate on that medical condition. You're going to be worried about being evicted. And so that experience showed me how powerful trust and connection really, really is in the community. Although I'd been involved in the community for many, many years, um, it was on a deeper level that we had to relate to these people. They were telling us things they wouldn't tell their doctor because they didn't feel comfortable. And so after I finished my 1,700 hours of service, I knew this work wasn't just a role, it was my purpose, it was my calling.
Thank you so much, Joanne. That's awesome to hear. With that, we'd love for you to share more about what influenced you to become a CHW, or how did you become a community health worker?
Well, I became it basically through AmeriCorps, but the work is really personal to me because I went through a lot of abuse at home, feeling unsafe and not sure of who I could trust. And so I'm here at Family Lifeline because Family Lifeline was one of those places that stepped up for me when I was a child. So to me, it's like going back full circle because although they don't have licensed clinical social workers now, but they used to a long time ago. Well, not that long ago, but a while back. And so to be able to come here and work here now and help people, I'm still helping children, just not as a licensed clinical social worker, but I'm still helping children. And so that's why I became, because I wanted to be the person that I wish I had more of when I was growing up. Someone that who sees you, someone who hears you, and shows up and helps you breathe a little bit easier, literally and figuratively.
That is so awesome. It's so great to hear your what influenced you to become a CHW and the full circle-ness of what you shared. As we conclude our time right now, anything else you'd like to share?
Just CHWs are needed, but it's not for everybody. You have to have a passion for it. It's not just a job, it's a calling. Just like a pastor, it's a calling. And so being a community health worker is a calling because it's not easy. But if you feel like that you have that compassion and that love and you feel like you are being called, learn what to do, contact CHW Strength and get trained to be a CHW. You won't regret it.
Thank you so much. I appreciate you, Joanne Johnson, in being our CHW in the spotlight on the center stage. Thank you so much.
Thank you for having me.